Well, every minute of the day, the Bakersfield Police Department responds to all types of calls for assistance. But a proposal set to go before the Bakersfield City Council this evening could change how BPD responds to behavioral health-related calls.
911, what's your emergency?
It's a scenario that plays out 24 hours, 7 days a week. Bakersfield Police Department emergency dispatchers answer 911 calls and send officers to the scene.
What's the address of the emergency?
But the way the department responds to certain calls soon could change. Specifically, the department is looking to partner with Kern County Behavioral Health on calls involving people who could be struggling with mental health.
Drop the gun!
This evening, BPD Chief Greg Terry will ask Bakersfield City Council members to consider hiring a behavioral health clinician to work at the Law Enforcement Communications Center. In a memo sent to council members, Terry argued hiring a mental health clinician would reduce law enforcement contact with people in crisis who would be better served by behavioral health staff.
This recommendation, if they implement this, it will help a lot.
Draco Matthews is one of the core working group members on the independent Bakersfield Police Department Community Collaborative. In May, after 6 months of research and meetings with community leaders, the collaborative released 20 recommendations to BPD to enhance trust between the public and police. One of those recommendations calls on BPD to better improve training for behavioral health-related calls, citing data from the Institute for Criminal Justice Training Reform stating that at least 25% of people killed by law enforcement nationwide exhibited signs of mental illness.
So many of calls that they tend to get, often folks are mentally distressed. And so by having a clinician, someone who can go and help to address the mental distress that, the person who is reaching out for help or needing some sort of mental support, making sure that they can get that instead of just having someone come in and potentially injure or harm the individual, that is crucial.
BPD Sergeant Robert Parris says the clinician will be part of a test trial, but he adds department leaders are optimistic the program will succeed.
Having someone that has that training, that level of clinical experience, able to have communication with the person when they call 911, it's hopefully going to be a win and divert some potential tragedies.
By implementing this program, I absolutely believe that lives could be saved.